We are well over a year and a half into this pandemic, and yet another surge in COVID cases right in the midst of the holiday season. Patients once again flooding local hospitals. The Mayo Clinic put out a hotspot map of Texas, so the higher the average daily cases in the last week, the redder the county. Take a look at North Texas, you see we are in the red. Chris Zadigi joins us now with more on these rising hospitalizations. Yet another variant, Omicron, helping fuel this surge. What have we learned about it, Chris?
Well, Mark, some of the things that we do know about Omicron variant so far is it appears to cause more mild symptoms than the Delta variant, but also much more infectious. UT Southwestern modeling is predicting that at this rate, they're going to have about 800 new COVID-19 infections per day in Dallas County by the middle of January. That's definitely a somber forecast at Parkland Hospital, where they had shut down their original COVID units, but now we'll have to open up 2 new COVID wards. Dr. Joseph Chang is the chief medical officer at Parkland and told us when he left for vacation last week, they had 35 active COVID patients at Parkland. That number is now 70, and 90% of them are not vaccinated, according to Chang. We've heard similar numbers from other hospitals in the area, including John Peter Smith in Fort Worth. This all happened very rapidly. Omicron took just 2 to 3 weeks to become the dominant variant in the country.
3 weeks ago, we were talking about Omicron taking up about 1 to 2% of the overall cases in America. We're up between 70 and 80% Omicron now.
And another impact of the variant, this transmissible, is it's also quickly infecting healthcare workers, leaving hospitals in a bind. Fewer people to care for more patients, something that could help with that, though. The CDC announced yesterday they're shortening the mandatory quarantine requirements from 10 days to 5 for people not showing any symptoms. The hope is that will help hospitals maintain the staffing they need. Mark.
Thank you for that, Chris. We are also seeing more kids hospitalized with COVID. Pediatric hospitalizations in the United States at their highest level since back in September, and up roughly 60%, by the way, from a month ago. Children's Health in Dallas tells us that they are experiencing slightly higher volumes, but they do say they are prepared and equipped to provide care for more kids in North Texas. And